a group of researchers led by the president of the Institute of Safety, Disaster and Emergency Studies, Dr. Ishmael Norman, decided to undertake research on all-risk emergency preparedness in Ghana's hospitals. And do you know what they found? Only 45.5% had respirators. Of course, Kofanochi Teaching Hospital is having some, Kolebu Teaching Hospital is having a number of them. What about the district hospitals? The least said about them, the better. Students at the KNUST have, for the past 2 years, been working on how to write a good ending to the story captured in the Ghana Medical Journal. Professor Mark Aduma-Samoa is Provost, College of Engineering.
Most of the district hospitals and community hospitals, they lack ventilators. So we initiated a project with the University of Michigan to build locally made ventilators.
Hospital-grade ventilator costs between 130,000 cedis and 300,000 cedis. The team, put together by Professor Mark Aduma-Samoa, has been thinking of less expensive ventilators.
We felt that if we could get a ventilator that could have the basic functions for human breathing, then it will go a very long way to help with our health delivery system.
The prototype has an initial cost of 20,000 cedis, which the college believes will reduce significantly if mass-produced. Professor Kwame Osei-Boateng is one of the project coordinators.
When you are building prototype, it's not that which we use to price the product on the market, but rather all these problems we are going through, once we are done, we would have prepared templates and we can then mass produce. When you are mass producing, you do a whole lot at a time, and so you are able to bring the price down.
Ashanti Regional Clinical Engineering Manager, Ghana Health Services, Eric Sakimensa, though is impressed with what is likely to be the first automated ventilator to make its way into Ghana's intensive care wards, he knows additional functionalities will be apt.
For a life support device like a ventilator, you need to check something we call the SpO2, the amount of oxygen in the patient. We need to know. Also, it's a monitoring device, so we need to get its temperature, check sometimes the ECG, and then we have some technicalities that we call something like the tidal wave. We need to know all these things. And when we discussed with them, they made us aware that they have all these things in the prototype document.
Professor Osei-Boateng has therefore been taking notes.
What we'll be adding to it is that as it is, it's already automated, but still there are certain functions we could still automate further. Because we are thinking that you wouldn't have, some people may not be in so critical a condition, such that they may be aided with the ventilator for a while, and then at the time they regain their composure and are able to breathe. Then the machine itself should be able to sense that now the person is okay, so it can go off by itself. Or if the person is okay and is on the person, at the time that the person begins to struggle, it should be able to detect and kick in so that it helps. These are the fine-tuning in terms of automation that we are thinking about now. Yeah, and in addition to this, we are thinking of adding devices that could also monitor the signals from the body, like the electrocardiograph.
The college says the ventilator, which is 95% complete, will be fully functional in 2 months' time, but will require financial support. For Joy News, Kwesi Deborah.